Hi, I'm Dana, and I am a survivor of necrotizing MRSA. Several years ago, back in June of 2020, I had what I thought was a routine ventral hernia repair. Instead, I contracted necrotizing MRSA that nearly cost me my life. The infection destroyed my lower abdomen to the point that I had a defect so large that you could literally place both hands inside of me and move them freely. And it basically went from hip to hip. Over the course of 8 months, I endured 5 debridement surgeries. Each admission meant 5 to 10 days in the hospital, usually in isolation because it was during the height of COVID and I had MRSA. Outside the hospital, my life revolved around wound care 3 times a week. I did IV antibiotics through a PICC line. I had home health visits and weekly visits to my infectious disease specialist. And despite all this, my wounds refused to close. My breaking point came after my last debridement surgery, which was in February of 2021. Lying there on the wound care table, realizing that I couldn't keep doing the same protocol and expecting a different result, because what is that? It's insanity, right? And I basically told the team to remove everything. I walked away, and for 10 days, I simply kept my wound clean at home. And at that point, I was fully prepared to die. But instead of dying, I chose to try something different. And I reached out to a functional medicine doctor. And for the first time in my journey, someone asked, "What is your body missing that it needs to heal?" She ran comprehensive labs, not just infection markers or CBCs, but nutrient panels, gut assessments, and metabolic testing. The results showed profound deficiencies in vitamin D, zinc, and antioxidants, as well as gut dysbiosis from months of broad-spectrum antibiotics, which I was on vancomycin, and when I was in the hospital, I was alternating between vancomycin and Zosyn, yet none of it worked. So here's what mattered most. She didn't work in isolation. She collaborated directly with my surgeon and my wound care specialist, and together they created a plan. I went back to wound care, but this time implemented my functional medicine doctor's protocol alongside the wound care team. And for the first time, conventional and functional medicine were not in conflict. They were actually working together, which is huge, right? So medical literature affirms what I experienced, which is over 70% of the immune system is housed in the gut. After months of antibiotics, my microbiome was devastated. Malabsorption and systemic inflammation were undermining every other intervention. By addressing gut integrity, removing the inflammatory foods, replenishing with probiotics, and using targeted nutrition to repair the microbiome, my absorption improved, inflammation decreased, and wound healing accelerated. Gut health wasn't a peripheral issue. For me, it was the foundation of recovery. Months of IV antibiotics, multiple anesthetics, and ongoing medications had left my body and detoxification pathways overburdened. The physiologic toxic load was impairing recovery. Supporting detoxification meant simple but evidence-based interventions, hydration, cruciferous vegetables to enhance hepatic clearance, gentle movement to stimulate lymphatic flow, and reducing environmental exposures. By decreasing the toxic burden, my body could finally redirect energy towards healing instead of constant clearance. Kind of like it's hard to drive a car if you don't have oil, antifreeze, all the things that keep the engine moving. You can't expect it to perform at its peak if it doesn't have everything that it needs, right? It's the same concept. So after 8 months of relenting infection and aggressive treatment, my immune system obviously was depleted. The functional medicine approach prioritized rebuilding through adequate sleep to reset immune regulation, nutrient repletion, particularly vitamin D, zinc, and antioxidants, stress regulation techniques to reduce chronic cortisol load, and gradual reintroduction of physical activity to restore circulation and immune mobilization. Combined with ongoing wound care, these interventions gave my immune system the capacity to finally participate in my healing. Here's the outcome. Once I combined my surgeon's care with the functional medicine protocol, literally everything changed. I never returned to the hospital again. Within 2 months of my first visit with my functional medicine doctor, my wound, which had resisted closure for 8 months, completely healed, and I have not had a reoccurrence since. Standard care kept me alive, and I'm profoundly grateful for it, but it was collaboration with functional medicine that restored me. That is why I share this story with you. Surgeons, infectious disease physicians, wound care specialists, because what you do in the hospital saves lives. But what happens after identifying deficiencies, restoring gut integrity, supporting detoxification, and rebuilding the immune system determines whether or not a patient regains their health. Patients like me just don't need survival. We need restoration, and sometimes it takes working across disciplines to make that possible, and I am living proof.